I am a registered nurse. I'm also a certified registered nurse in infusion therapy. Currently, I am a nurse consultant for a company called MCV and Associates, and that is a company that is a consulting and an education company, and we specialize in training nurses and other healthcare providers in infusion therapy and vascular access. Start IVs and also start PICC lines, and as well as caring for central access, central vascular access, and other therapies that we actually give for those devices. We work a lot with technology. This is one area where, I would say 50% of the time we use technology to take care of our patients, or even to find a vascular access. And so if you're not inclined to work with those, this might not be the area for you. When I was working at a regional hospital here, they had an IV team at that time, and I always have admired, those nurses. Their responsibilities was fascinating to me. So at some point, everybody makes a career change, and I thought, well, I'm really tired of ICU, so I wanted to venture to do something else. And so I asked if they would take me, and because of my experience with ICU, and also because of my experience with lines, they were very interested, and that's kind of like how I got started. If you're a new grad, you can't just get out of school and go right into infusion nursing. It really takes a lot of, and you rely a lot of your past experiences. The most important thing is that truly you have to have at least medical surgical experience, if not CCU or ICU or even the emergency room, because in those places it actually helps you develop your assessment skills and your critical judgment skills, which is very important when you are an infusion nurse. And then of course the technology part of it comes in, and of course you have to be a little bit more technology savvy. And that can be learned, but it's the assessment skills and the critical judgment that helps you determine what's best for this patient, knowing that they're going to get this kind of therapy, what is the best vascular access for them. So I would say, you at least have 1 or 2 years experience in general medical surgical nursing, or even ICU critical care or emergency room. And then also just the ability to be independent, because a lot of times you have to be by yourself to do all these things. I would say, the last few years I have seen at least, the resurgence of specialty group of nurses. We don't probably call them IV teams anymore, but we call them, it's a group of nurses that are dedicated to taking care of patients with vascular access. And this goes along with the initiative right now to reduce or prevent catheter-related bloodstream infection. As always, they have found that if you have a group of nurses that are specialized and very meticulous in what they do things the same way. There's no variation. And as a result, it is truly one of the ways that you can prevent catheter-related bloodstream infection. So I'm seeing a little bit more of that. They're not as big as the old IV team that we had. Before there were 15 of us in the team. Now you'd probably find 2 or 3, 4 at the most. But the other thing on the infusion therapy side is there's now a lot more biologic therapies that are given intravenously. And these are for chronic illnesses and autoimmune disorders that before we would not have any treatment for. And so that is exciting because there's, again, for diseases like rheumatoid arthritis, for gout, for Crohn's disease, and for psoriasis. There's a lot of new biologics, and they're all given intravenously. So that is very exciting as well, aside from just the traditional chemotherapy medications that we give. The technology is just expanding. We have now a lot of different technologies to help us find exactly where the veins are, especially for those patients that are very difficult to access veins. And then we also have technology. We were inserting a PICC line that tells you exactly where you're going and whether you're in the right place. that's very exciting, and a lot of ultrasounds now are, are heading that way. The other thing is the expansion of some of the responsibilities of the PIC nurse or the nurse that's inserting a PIC, to where they would add or be allowed to interpret, initially do an interpretation of the X-ray for line placement, so that the patient can receive their therapy right away. So there's a lot of nice and exciting things going on. Sometimes you don't go for it because you don't have the IV experience, but nonetheless, don't give up. Everybody has to start from scratch. So try to get in, and to me the most important thing is just not getting the experience and being in an IV team or doing the specialized procedures, but it's also the credentialing. There is a certification program for registered nurses, and that certifies you to become an infusion nurse, and that is the only true certification. So I think everybody should aim for that particular certification.